Hi, everyone, and welcome to the agency admin webinar for HMIS. We appreciate you taking time to be with us today. I'm going to do some introductions so that you can be familiar with our faces, the HMIS team faces. My name is Hillary Evans, and I'm one of the newer team members, and then I'm going to ask the rest of our team to introduce themselves.
I'm Glory. I'm the manager here for the HMIS.
My name is Thaddeus. I'm one of the program specialists at HMIS.
I'm Sam. I'm also one of the program specialists.
I am Stephanie. I'm the customer support representative for HMIS.
Great, thank you. And then we have a special guest with us that I'll be introducing later. We'll go ahead and get started. Some important notes for those of you on the call today. The first portion of the webinar today is going to be relevant to both Balance of State and Maricopa. The last portion is regarding COVID reports available in Service Point and is relevant to all agencies that are utilizing the COVID screening in both Balance of State and in Maricopa. However, we encourage anyone interested to stay on the line to learn more about the reporting opportunities. Also, if you want to be able to capture these COVID-19 data items, let the help desk know, because we are able to give access to these COVID sub-assessment questions for your agency. The last important note is for both continuums of care. If your agency is seeing significant change in either workflow or capacity, please let us know by submitting a ticket. Oh, I'm sorry. I'm just getting the note. Can you not hear me? Okay.
I can hear you now.
Okay. Yeah. We say that every week, but if there's any changes that you need us to know about in workflow or capacity, please let us know. So let's switch over to the agenda for today. So we're first going to be meeting with one of our 211 supervisor here at CRN to talk about 211 Arizona. As you know, we started this last time where we're going to have an agency highlight every time we meet, and just to make sure that. So next thing we're going to be doing is talking about the annual self-certification, and Thaddeus will be giving an update about that. And then Gloria will be talking about when you collect an RI for street outreach programs for PATH. And finally, we'll be discussing what COVID reporting is available to you on Service Point. So I'm going to turn it over to Thaddeus that's going to be doing the webinar reminders.
All right, so remember to share what you've learned with any relevant staff at your agency during this webinar. To ask questions, use the Q&A function. Common questions are answered live, and then the answers are later aggregated and shared with our follow-up email. And longer questions can be emailed to the help desk if you're concerned about it being too hard to type out during the webinar itself. Keep in mind that your agency's attendance is required, but we always make that recording available later. We email the video links by the following Monday. For today's webinar, that means Monday, July 6th. And also remember that any users not in attendance will have until Friday, July 10th to watch that video and take the little quiz that's associated with it. I'm going to hand it right back to Hillary now.
Thank you, Thaddeus. So I get the pleasure of introducing you to Amina Torre, Amina Torre, who is the supervisor for 211. Amina, are you with us?
I am. Hi, everyone.
So Amina's going to tell you a little bit about 211. And as you know, the service was unavailable for a little bit in terms of phone calls, and now is up and running again. So we're going to let her share about that. Go ahead, Amina.
Thank you. So everyone, I'm Amina, as Hillary just mentioned. So overall, the scope of 211 is just problem solving and empowerment of our callers. So we deal with all specific areas, including social needs, COVID-19. We have a COVID-19 line in regards to if they have questions regarding any executive orders for COVID-19, any questions in regards to like where to go to get testing, any information on how to remain safe for COVID-19. So we have a line for that service. We also have an eviction prevention line that is contracted through the Arizona Department of Housing to assist those who are renting with preventing eviction during this pandemic. So we run that line as well. We have, starting on July 1st, the contact tracer side of it for Maricopa County only. So those will be an outbound call center. That call center will be from 8 to 8, and they will do contact tracing for those who have tested positive for COVID-19 to reach out and provide information to those who may have been in contact with those individuals. And then we also have the general 211, which handles social determinants of different functions, homelessness, domestic violence, food and clothing. We still also have the 211 website, which we continue to improve. Our hours will change over to 24/7 as of July 1st as well. So we'll be available 24/7 right now. Currently, this is our last day, 8 to 8, and we look forward to growing and building.
Awesome. Are there any questions for Amina about the 211 program or 211 line?
And I just also want to mention that if there's any update, or if you're already a part of 211 and you need to update, or we do that quarterly, and we have a resource team that does that. You can go on 211's website, or you can reach out to myself, and we will get you over to the correct people to update any resources that you may have, or any flyers you may need as well.
Cindy Flores is letting us know that she's glad that 211 is back. I think we all feel that way.
Yes.
A real gift to the community. So we wanted to talk about 211 just to ensure that you were able to go back and update your agencies to let everyone know that it's 24/7 again, starting tomorrow, and available for the clients you serve or whoever needs it. So the question was, can anyone use 211?
Yes, 211 is available to anyone to use. If you're calling in and you're like a caseworker, then you just notify us that you're calling on behalf of someone, and then we will assist you accordingly.
And this is for the 211 is for the state of Arizona.
It is.
Yeah. Great. Amina, if they want to get literature, or not literature, but yeah, like some marketing material, how would they go about doing that?
They can reach out to me and I can get them marketing materials in regards to 211. I also do want to let you know, I know that we sometimes have clients that are a little bit more, would prefer not to share their information. There is an option for them to go on the website to do that as well. And we can email them information instead of them verbally talking to us, so that I'll put my information in the chat for my email address, and you guys are more than welcome to reach out if you like some marketing materials.
That's great. So if folks want to stay anonymous, they have that option in
They do.
contacting 211.
Oh, and I just wanted to mention, we also just started the crisis counseling program. So it mentioned on every call where we will get them connected to a counselor that can assist them during the pandemic as well. And that's free. It's through FEMA. And so it's a free anonymous service that is available too if you have someone who's being stressed out about the pandemic or any situation really that involves a crisis.
And that gets them, does that connect them with like a licensed therapist of some kind?
It does, and it is a anonymous service, and it is something that they can ask for, but we do offer it on every call.
That's wonderful. That's a great service.
Yeah, it is.
So yeah, if you're working with folks that are dealing with excess stress right now and need to talk to a therapist but don't want to travel or go through that process of getting set up, they can call 211 and get connected to a therapist. Exciting news. Busy time for 211. Start up tomorrow with 24/7 activity. Thank you so much, Amina, for joining us today. We really appreciate it. Yeah. And thank you for sharing your email with everyone. All right, so I'm going to turn it back over to Thaddeus, who's going to be sharing with us a reminder on self-certification.
All right, so where are we at now with the self-certification? We had a due date back on June 15th. We allowed an extension until yesterday, and last we checked, we are still missing some. Therefore, our next step is that we'll let Arizona Department of Housing and the Maricopa Association of Governments have a list of agencies that haven't replied with their self-certification. So if you haven't yet, you're going to want to submit those things to us as soon as possible. And if you have any questions, let us know, but otherwise we will keep on moving ahead.
All right, I'm going to turn it over to Glory for to explain the ROI for street outreach programs.
Sure. So we get asked in training quite a bit when the appropriate time is to present the ROI and to, especially for street outreach workers who are dealing with clients that they, by definition, have to build trust with over time. So what's highlighted just really briefly here about when to record this, you do want to record an ROI in HMIS whenever there's personal identifiable information involved. So for the street outreach folks on the call, there may be people that you encounter that give you their street name, a code name, that aren't willing to tell you their full name, maybe just their first name. If that's the case and they you don't have an ROI for them, they're not willing to sign one yet, you're still building that relationship, that's acceptable to still put their information into HMIS because it's identified. As soon as they have their full name identified and the person who was red hat under a bridge at this particular address becomes Jane Smith, at that point, you definitely need to have an ROI recorded in the system. The date of engagement as well is particularly important. So the date of engagement within street outreach is defined as the date in which the client agrees to have case management services. And the ROI needs to be recorded at very minimum when there is personal identifiable information and at the date of engagement. If a client initially says no on their ROI, just as a side note, they do have the ability to revisit that at any time. So a client can say, hey, I agreed to share my information in the past, and now I want to revisit that, or vice versa. Go to the next slide, please. So street outreach workers in particular, again, just to touch on the piece about building trust with your clients. Managers that I've worked with in training are really great at building a rapport with their clients. And we just realized that this does take time and effort to build trust with clients, that you may encounter them multiple times before they're willing to sign any kind of documentation agreeing to share their information. With that in mind, how case managers and street outreach workers present the ROI to a client is also vitally important. So I believe that, again, the people that I've talked to are really great at these pieces, but it can be presented in a way of, hey, do you want your data shared with these list of different agencies, or presented in a way of, there's different services available for you at different agencies. And if you are willing to share your information, then there may be other resources that are available to you. So really just taking some time to explain the implications and what all of that means. And then this slide is very particular for those who are from the balance of state. In the balance of state, the system is designed so that the ROI tab has visibility implications. So when the ROI is not recorded, it does limit the services that are available to that client. So very, very important. Again, if a client has any personal identifiable information, or at the point where they have a date of engagement, we absolutely need to have an ROI recorded on record in HMIS. For balance of state also, just to touch on that, we do have an ROI report that is available to you that will compare the clients that do have a date of engagement but that are missing an ROI. If you're interested in that report, please reach out to the help desk and we'll be able to walk you through the next steps.
Thank you, Glory. I think we can keep going. Very helpful information. So next we're going to have Sam share with us about the COVID-19 reports. There are agencies in both Maricopa and BOS inputting data regarding COVID, and so we wanted to make sure you knew that there are reports available to you so that you can understand the data and utilize it in a way to make decisions about funding and about your program. So Sam, go ahead.
Right, awesome. So there are 5 COVID-19 reports. We'll show them all in art, and we'll go over each one. There's basically 3 flavors. Some are just very similar, but they're available in both Balance of State and Maricopa. So I know Maricopa is using some COVID-19 data collection actively. In Balance of State, while it's not required by every agency, individual agencies, as Shirley mentioned earlier, can definitely request from the help desk to get access to those data elements if they want to use COVID-19 data elements to better track either symptoms or testing for their clients, as well as kind of prioritize them for housing and so forth. But they're available on both sites. So they're located in the following pathway under Common Agency Reports and COVID-19 Reports, which we'll show in just a moment. And then, as I mentioned, Balance of State, again, of course, can request these fields. So there is an agency or two that does use these. So these reports are relevant to them. And these reports can definitely be relevant to anyone who does want to use that data. Can we go to the next slide? So there are 5 basic reports, but they're really broken down into 3 categories. The first one is a funder report. So ADO did provide some funding for a number of agencies in Maricopa as well as Balance of State for emergency shelter functions. They had a required report. We actually built that report out in art, so you can run that report automatically instead of trying to tally all that information by hand. There's also reports for the high-risk screening, which is just a way to prioritize clients for services and housing, as well as reports for the sub-assessments, which are just really for identifying clients who are symptomatic, who've been tested, or who may have recovered from COVID. So, would I be able to share my screen so I can just show everyone where these reports are and we can take a closer look at them? Okay, perfect. So we'll go to our Balance of State site here. It'll be in the same location for Balance of State as well as Maricopa, but you'll navigate to your public folder. We'll navigate to Common Reports, or in Maricopa, it's called Common Agency Reports. And we'll see the COVID-19 reports. So we see 5 reports here. The first one is a ADO funded. So I'll show you this report. This will be very familiar to some of you who are funded by ADO for coronavirus projects. But really, it's just a breakdown of what the ADO is requiring from those projects. So you'll select your prompts for the month. It'll automatically tabulate the number of bed nights, clients served, and bed nights broken down by race, by ethnicity, by gender, and age groups. And I'll have the full information. You also have a client detail tab, which will give you more information on each client who was served within the month there. It's a pretty standard report in terms of prompts. You'll simply select your entry and exit dates, and to select the time period you want to report the information. We'll actually work on building out this part here. Right now, you'll have to just tabulate this by doing each month's reports and summing it, but we'll work on this week and getting this to automatically populate for you as well. But it's just a very straightforward. You select your start date, your end date, as well as the provider, the project that is being funded by ADO. Now, the next 2 reports are for the COVID-19 high-risk screening. So as a quick reminder, that is relevant to these fields here. So in Maricopa, this will be very familiar. For Balance of State users, you may not have access to this unless you've requested already. But really, these reports are for these questions here, really identifying if a client or a family is at risk for COVID at a higher risk than some other individuals or families in the system, and just helps people prioritize those clients accordingly. Now, there are 2 reports. The real basic difference is one you can run by provider. So you can say anyone who's entered my program, I want to see all of their information, or you can select a group of client IDs. Let's say you're working with the by name list and you have 100 clients, you want to see how they might rank against each other. You can input the client ID instead. That report looks like this here. Wrong one. Looks like this right here. So it'll simply give the client ID, their information, first, last name, and the provider, if you did select a provider. And then it'll give their entry exit date, some basic information, and then I'll give you a tally of your score. So you can go ahead and filter these out so you can see exactly which clients might be at highest risk. And you can really identify the clients who might be at greatest risk of COVID based on them having lung disease, heart disease, and so forth. But this will help prioritize clients with your project or with the BNL if that is something you're looking to leverage. The final report, two reports are for the COVID-19 symptom test and recovery. So I'm going to jump to that. This is referring to the sub-assessment here. And this is where we're recording information about, is a client symptomatic? What symptoms do they have? Have they been tested for either antibodies or for just an active virus? Have they been, do they have a recovery date, and so forth? So the difference between these reports is that this one you can run by a provider. So you can select, of all my clients who've visited my project this month, what is their information? Have they had experiences with COVID or 19? The system-wide one will run the report literally for the entire system. It will be limited by what you're able to see based on your visibility. So if data is not shared with your agency from another agency, you won't see that. But if you run this one, you'll be able to see every client's results throughout the entire system who does share data with you, and that can really be enlightening in some cases. This report has quite a lot of data, so I'll pull that up and go over it real briefly. So the first one, it just shows the provider participation, basically how many records each provider has used, created of the COVID-19 sub-assessment. This one will give a summary of important dates. So the most recent date the client's been symptomatic, most recent date they've been tested, and so forth. This tab goes ahead and shows every client who is symptomatic in the system and has been. You'll notice that some lines are yellow and some are not. The yellow line means basically it's an old record. So for example, this client has 3 records, 5, 7, 20. 20 is the most recent record. So it might be prudent to just go ahead and filter out those. If you want, filter out those yellow lines so you can just see the most recent information. This tab shows all the clients who've been tested. This tab shows all clients who have recorded as being recovered in the sub-assessment. And then we also have tabs for showing the client's most recent provider, as well as all of the client's enrollments in the past 90 days. This is really most relevant for contact tracing, or if your client who does present with COVID-19, can help you understand where the clients come from, can help you understand who to contact if you have concerns about where they might have gotten COVID from or where they might have spread it as well. And then for street outreach projects, those clients who do report as being symptomatic, they will show their most recent, their most recent services and where they were located or where they were contacted. So that's a real quick rundown of those 3 reports.
I just have a few questions regarding that
definitely.
report. So the first question, would the symptom test recovery report, so the report you were just looking at, the COVID report, would it show results for our clients put in by other providers?
Only if their data is shared. So if you have a client who went to a different provider and you have agreed to share data agency to agency with HMIS, you'll be able to see that data. But if your client goes to another provider and they absolutely do not share that data with anyone else in the system, so they don't coordinate services, you won't see that. It'll be entirely dependent on your agency's agreements and whether or not you're sharing data. Any agency that does share data within, well, actually, this is on the universal data element, the universal data assessment. So the vast majority of cases, if your client goes to another project, you will see this information. The UDE assessment is globally shared. So you would see this if your client does go anywhere else, actually. So
great. Glory was also going to answer this question. Go ahead, Glory.
Oh, I think Sam covered that. Great.
Okay. All right, great. So the next question we have is the system-wide report HIPAA compliant? Can we get in trouble for looking up our clients and seeing records recorded by other providers? Gloria, you want to take that one?
Sure. So when we first implemented the COVID-19 risk assessment questions and the sub-assessment, we were very careful to be in compliance with HIPAA from a federal standpoint and from HUD standpoint. We sent out some blast emails that gave you links to those websites for HIPAA. If you're interested in those, we'll provide those. I can provide them in the chat today or as a follow-up after today's meeting. The system-wide reports, as Sam was describing, they're based off of your visibility. So if your agency agrees to share data with other agencies and a client's account is not locked, so on their ROI, they have said, yes, that I want to share my information in the same way that you can look up that client and find their name in HMIS and see what agencies have served them in the past, they would show up on that report. But it's limited to your visibility. So even though it's labeled as system-wide, you're not going to be able to see data in the system from other providers that your agency and your account is not set up with visibility sharing agreements in place.
That's great. And yeah, one thing to note too regarding HIPAA is, so the information collected in the COVID assessment, this COVID-19 symptom test and recovery report, is that the information that's provided in there is self-reported. So it's not information that the case manager is going and getting from the hospital or calling a health provider to get an update. It's self-reported from the client specifically, or the resident. So yeah, if that helps. So that's one of the ways it's not HIPAA protected information, if that makes sense. So Sam, was there anything else you wanted to say about the reports while we're waiting for some questions?
No, not this time. If there's any specific questions after anyone reviews the reports, you can always contact the help desk and we can walk anyone through them or provide more information once you really dig in.
Yeah.
Could I ask a quick question?
Oh, sure. Yes, please.
It may have been a sound artifact or maybe someone misspoke, but it sounded like for a moment that Sam had said the yellow bars are for older records and then later said the yellow bars are for newer records. Could you specify one more time just in case anyone else heard what I heard?
Yes, so the, let me go ahead and show here. The yellow bars, let me clear this. Oh, filter. So the yellow lines are for old records.
Okay, thank you for that.
So yeah, and thank you. This report that Sam has up right now is actually a really fantastic report. And I've been utilizing it for a lot of different things, and just we're learning so much about, in terms of demographics, about the folks that are testing positive. And I think it is really important in telling our community's story of what folks are facing and who is being affected by the coronavirus. So if you're not using this tool and would like to, encourage you to reach out to us, because I think it will help in telling the story of how your agency is being affected by COVID, which is really important.
Thanks so much for attending, everyone. Before you log off, we always appreciate your feedback. So we'll be sending a survey here quickly to ask what you thought about it. We always go through those every single month to review them and take them into consideration. If you didn't get a question shot off in time, go ahead and send it to the help desk afterwards. Thank you so much for your time, and we're glad to be here for you guys.
Thank you, everyone.